Okay, well, hello, everyone. I am Dr. Clint Strong. I work for Jordan Valley Community Health Center here in town. Are we ready to go? Okay. I'm a family practice physician, and I'm from Springfield, here in Springfield, Missouri. I lived here most of my life. I went away for college and medical school. I did medical school down in Birmingham, Alabama. Roll Tide. I've got them picked for the tournament.
Oh.
So we'll see how it goes. What else can I tell you about me real quick? I'm married. I have 3 daughters. They are 22, 20, and 17. My oldest got married last June, and that's about it. My folks live in town. My wife's folks live in town, so we are Springfield people through and through until all of our parents are gone. And then who knows? We might decide to go somewhere. But we're going to be sticking around as you get older, as you will find out someday, and your parents start getting older. There's lots of things to do with aging parents. So it's nice to be around, keep an eye on them a little bit. I've got 2 brothers. One of my brothers was a fireman, and my younger brother was an engineer. That's about it. That's my crew. I got 2 little dogs, Cavapoo and a Cockapoo, Izzy and Stella. They're just dear to my heart, of course. Actually, my girls picked out those dogs. I would prefer to have like an Australian Shepherd or a Golden Doodle or something a little bigger, but you know, when you have 3 girls, you just kind of go with the flow. So welcome to the Jordan Valley Integration Talk. I think that's what we're doing today. Sorry, I don't have any slides for you. The last time I did this, I didn't do slides, so I wasn't thinking about doing slides, but maybe next time I'll have some slides for the next class. So please let me know if you can't hear me. I'm a pretty loud talker. According to all the women in my life, I don't know how to whisper. And so when I try to whisper, they tell me to be quiet, everyone can hear you. So let's go around the room real quick. I want to find out a little bit about you guys. I know some of you. I kind of know Nelson here, and I know Pete. I know Zenobia and Ivan, and I just got to work with Phil for a week. But what about the rest of you guys? What's your name?
So I'm John. I'm from AT Still University. What else do you want to know?
Let's see. Are you all 3rd years?
Yeah.
Okay, so you're all 3rd years. And what are you looking to do when you finish med school?
Family medicine.
Family medicine, great. Nelson, how about you? What do you want to do?
I'm still up in the air, but I'm thinking about pediatrics.
Okay, great, great. All right, how about over here?
I'm Maddie from AT Still, and I want to do internal medicine.
Okay, medicine, very good.
I'm Laura, I'm from ATSU, and I'd like to do interventional cardiology.
Very good, very good. High aspirations, I like it.
I'm Abby, also from ATSU. I don't know what I want to do, but I think OB.
OB, okay, very nice.
I'm Amy, I'm from ATSU, and I'm leaning towards EM.
Okay, emergency medicine. I was just talking to Andy. We had Andy Payne with us this week, if y'all know Andy. So I know this is an exciting day too. I didn't address that yet. Exciting day. People are finding out where they're matching today. So are you guys hearing from your friends already? Okay. I heard from Andy. He matched emergency medicine at KU. KU. Okay, he was excited about that. So that's great. All right. How about you over here?
I'm Carla, I'm from KCU.
Okay, very good.
I'm Abby from KCU and internal medicine.
Internal medicine. We got a lot of medicine folks here today.
Prapti, also from KCU, and I'm interested in peds.
Okay, and you worked with me too, didn't you?
I did,
Okay,
yeah,
I was gonna
first
say, I recognized you. I
rotation.
couldn't remember. It's been a while. That must have been early on.
It was the very first one, yeah.
Yeah, fantastic. Okay, back here in the corner.
Gabby, KCU Joplin, and I'm looking at family med.
Very good. Zenobia,
Still Zenobia, still FNLB. I'm here.
very good. Ivan,
KCU 3rd year, internal med, critical care.
internal medicine, critical care. That's right.
And Liam, 3rd year, ATSU, dermatology or anesthesia.
Very good.
Phil, KCU, 3rd year, surgery.
All right, that's right.
Jared, KCU, 3rd year, EM.
All right, emergency medicine.
Ricky, I'm from KCU, and I'm gonna apply anesthesia.
Anesthesia, very good. And Pete?
Pete, 3rd year, KCU, and I'm applying there.
Sure, excellent. Okay, well, welcome everyone. So you're already making application to your programs, is that right?
For audition.
Not-
For
not yet,
auditions.
yeah. Auditions.
Audition.
Audition rotations.
So you applied to audition rotations?
Yeah.
Okay. And then when do you have to have like all of your residency application stuff in?
September 4th.
September.
Okay, so come here soon.
That's perfect.
Thinking about that.
Already.
So, so I'm here to talk about Jordan Valley and we are a federally qualified health center, which if you don't know what that means, I don't really either, except that we get government funding. No, I do, it has a lot of intricacies and things that bring about being an FQHC. So we call ourselves Jordan Valley Community Health Center. So our goal is to take care of the underserved, medically underserved in the community, people who have barriers to getting care, whether that be transportation or insurance. They a lot of times just have difficulty even maintaining a phone, much less a car. So we try to help them overcome those barriers and get the medical care that they need. I told you I'm a family medicine guy, so I went away to school. I came back here, I did the Cox residency, partly because it was in my hometown and partly because they were the only residency I looked at that had electronic medical records back in 1999. So they were ahead of the curve for EMR. I wanted to go somewhere where I could learn EMR, and I ended up staying here. My plan was actually to go back to the South. My wife and I really love the South. We really enjoyed that, enjoyed being close to the beach. But we're back in Springfield and still here 25 years later. So it's not a bad place to be. But Jordan Valley, one of the things that drew me to Jordan Valley is definitely the mission. So most of you probably went into medical school, and I was talking about this maybe this week, I think maybe with Phil. Your personal statement was all about, you want to help people, you want to make a difference in people's lives. And then you kind of go through medical school, you get a little bit worn out, jaded, you go to residency and they beat you down some more. And then you finally come out and you're like, okay, I'm just ready to make some money. Forget these people. I'll take care of their medical problems, but I'm just doing it for the bucks. So that can kind of happen sometimes. You get a little cynical, a little jaded. I definitely came out a little jaded. But I worked way too much in residency. I did residency before they instituted the 80-hour work week. And I often tell my students about the book, The House of God by Samuel Shem. So if you haven't read The House of God, I recommend you read it as a student and then read it again when you're in residency, because it will take on completely different meaning for you. It's very entertaining. It's a little racy, so disclaimer, don't recommend it for that reason, but it's really cynical, humorous, and is written in the late 60s when residency and internship was way worse than what I had. So lots of rites of passage, lots of hazing, lots of scut work, but lots of fun too. So back to Jordan Valley. I got on board at Jordan Valley. What drew me into Jordan Valley was the way that they take care of people. They try to meet them where they're at, and they try to do the best they can to make a difference in their life or in their lives. So that's kind of gets back to the reason why I originally went into medicine back in the day. So that kind of got me a little bit excited. Making the transition, I worked in private practice for about 9 years before I moved over to Jordan Valley. So making that transition was a little painful because it's very different working at a community health center versus private practice. In private practice, you have a lot of control over a lot of things. You have control over your schedule, you have control over who you see and who you don't see. You can, you can say, you know what, I'm not gonna see anybody on benzos. You can say, I'm not gonna see anybody on controlled meds. You can do all sorts of things like that, set parameters, and no one is really going to tell you, hey, you can't do that. You need to see these people. Because you're in private practice. Even if you're employed by a hospital entity, they don't really regulate much of what you choose to do as long as you're maintaining your certifications and getting your trucks done. So I came to Jordan Valley, a little bit painful in the sense I didn't have as much control over things, but we were seeing all kinds of people, and they basically take all comers. So Jordan Valley is the kind of place where people go when they have burned bridges at other medical offices and they don't have anywhere else to go. When I came to Jordan Valley, they were just, the pediatricians who had been there had just left. So they were not playing nicely together with each other or with the administration. I think they were giving some pushback on the admin telling them, hey, you need to prescribe these kids their medicines. They were saying, I don't want to do stimulants. I don't like doing that. They said, well, you need to take care of the kids and take care of their needs. So they said, you know what, we're just gonna have to part ways. So I came on board as a family medicine doctor, and they said, hey, we need somebody to see kids. So I started seeing a lot more kids. I went from about 80% adults and 20% kids to about 90% kids and 10% adults. So it's a nice learning curve because at Jordan Valley, we have a lot of special needs kids, a lot of behavior problem kids, and even like congenital heart disease kids. So lots of issues, lots of things I got to read on and do a lot of learning for a while there. So that was part of the growing pains too. But in all, it's been a fantastic experience. The people I work with are incredible. Being able to work with the kids and try to speak some encouragement and truth into their lives. You know, a lot of times they get beat down at home. They may not get any attention at home. Even in the office, a lot of times their parents are just on their phone playing a game. And I'll have to ask them, hey, you know, would you mind putting your phone away for a couple minutes so we can talk about your 6-year-old? Because the 6-year-old's not telling me everything I need to know for themselves. But one of the wonderful things that we are able to do because we're an FQHC and a community health center, we get some extra funding and some grants for some special projects. Since we have high need patients, we're able to apply for grants and get those grants that will cover things like community health workers or help pay for maybe some physical therapists or occupational therapists. We're able to have behavioral health services in the office with us. A lot of places you'll go and work with physicians and you'll see between patients, you might go back to their office and you hang out in their office with the doc and it's just you and the doctor in their nice office and you got a little privacy, you got some time to chat. At Jordan Valley, we have kind of more of the shared workspace. So we have a very collaborative practice. Whether you're on family medicine or you're on women's health, you're on behavioral health, we have psychiatry there with behavioral health consultants, it might be social workers, they might be psychologists. But whatever it is you're doing, you're in a common workspace with other professionals. And whenever you have something come up that you need extra help on, you're able to just grab somebody and get that help. On the pediatric team specifically, we have occupational therapy, we have physical therapy, we have optometry in the house and in building right down the hall. So if I have a kid who the parents say, hey, you know what, I'd really like to get Joey's eyes checked because they're having trouble seeing at school, the teacher told me they're having trouble seeing, I'll say, well, hey, you know, wait here for a second, let's see if the optometrist can get you in today. And we can get them in to see the optometrist usually, if not the same day, the same week, and then get them going with some glasses. So that's one of the really nice things that I love about working at Jordan Valley. Just the ability to actually take these kids and make a big difference in their life in a pretty short time frame. I mentioned behavioral health. So I have a behavioral health consultant that works on our team with us. She sits right catty corner to me. So when I go into a room and I've got a difficult kiddo who's, you know, maybe 13 years old, or struggling through middle school, they're having some anxiety or some depression, I can say, hey, you know what? I think it sounds like you need to talk to somebody about these things. I'm not a therapist, but let me grab you somebody who is. And so I'll just go out and grab Amanda. I get Amanda plugged into the room, give a nice warm handoff, introduce her, and that patient's able to do a brief therapy session right there, get set up for follow-up in the next couple of weeks. And if Amanda and I think that they need medicine, I can start them on medicine, see them back a couple of weeks after that, and you know, really get them kind of a better boost on their treatment. Gets things going a lot quicker. So that's what we mean at Jordan Valley when we say we have an integrated model of care. So I think that's my topic today, right? Integration of care. So we integrate behavioral health in medicine. We integrate optometry into medicine. We integrate occupational therapy into medicine. If you've all done your pediatric rotations, which you probably all mostly have at this point, you've seen some babies with some flat spots on their head or some flat spots on the side of their head. We call that brachycephaly or plagiocephaly. You'll see kids who are delayed on their milestones. Maybe they're 9 months old and they're not crawling yet. So when those things happen and you're in a private practice, you make a referral to occupational therapy, they get on a wait list and they might get seen in the next 3 to 6 months. But at Jordan Valley, I go grab the occupational therapist or physical therapist down the hall. I tell them about my case. They come in the room, see them right then. They might coach the parents on some things they could do differently to help the situation. And then they'll see them back every week or every 2 weeks for therapy sessions until they are able to help that kid get to those milestones and graduate them from the program. So it's a really, really excellent model of care, I guess. Let's see, we mentioned OT, PT. Oh, we also have dental. So our main integration, I would say, probably the biggest, most important one for kids especially is dental. That's a big deal for women's health too. So a lot of pregnant ladies will come in, and if they don't have good oral hygiene, it can cause lots of other problems, infections, poor nutrition, all kinds of issues. So a big push that we have in our women's health program is get these ladies in to see our dentist, who's right there in the same hall or one hall over from the exam rooms, but in that same side of the women's health clinic. And the dentist sits right there in the pod with the medical providers, with the behavioral health provider. So it's really integrated. So when I have kids that come in and they have visible decay or erosions in their molars from eating too many fruit snacks, then I just go grab one of my pediatric dentists, say, hey, can we get this kid in to be seen today? And most of the time, the answer is absolutely, we can get them taken care of. We get them over to a dental chair, they get them x-rays, get them seen, and get them lined up to get some restoration done for their teeth. So that is the beauty of integrated care. Man, that's going really fast. So, what kind of questions do you have for me about Jordan Valley or integrated care,
I have a question.
or how we do it?
So actually
Yes.
2 questions.
Yes,
So
ma'am.
how are all of the appointments then based off of like scheduled appointment times, or are there a lot of open spaces available for that type of situation?
That's a good question. So for behavioral health, they do have a schedule where they schedule therapy sessions, but they have spots in between. That way they have free time to do consults in the office. For dental, the way dental works is very different from medicine. So in medicine, the clinician spends probably the most time with the patient when they come in for a visit, right? If you've ever been to the dentist, which most of you probably have several times, hopefully every 6 months. But when you go to the dentist, you spend most of your time with an assistant or a hygienist. They do all the work, and the dentist comes in for about 2 minutes. And so they have several, I forget, they call it a column. They have several columns on their schedule. So one dentist will run 4 columns at least, I would say. Sometimes they might run 6. So they'll have 6 people per time slot on their schedule that they are bebopping around, doing different things, checking their teeth, doing a filling here, a filling there. But we have several dental assistants and hygienists that will be seeing those patients and doing the x-rays, doing the cleaning. So even though they work still different, we basically have the flexibility to work people in. One of their columns on pediatrics that we have, so we have 4 columns on peds, so they'll have 4 different chairs they're running throughout the day. And one of those chairs is specifically for emergency cases or walk-in cases. So if a kid is having tooth pain and they call in or they walk in, we can get them right into a chair, get them x-rays, get them going on treatment. So some scheduled for dental, some open. On the medical side, we do have a pediatric express care. We start out by just broadcasting that we would take walk-ins, saying we will not turn away any sick kids. So that was one of the things that came down from above in the administrative side of Jordan Valley. They said, hey, we want to see any sick kid that walks in. And so as providers, we said, okay, how do you want to do that? Because we're already pretty busy and our schedules are full. They said, well, you have a lot of no-shows. We said, well, yeah, but that's when we look at YouTube, you know? Actually, we didn't tell them that. But they said, well, you have a lot of no-shows, so let's start by filling your no-show slots with walk-ins and see how that goes. So it went really well. We got even more busy. So then we started having a designated provider. We started by blocking slots on our schedule for walk-ins. And then we started having a designated full-time provider from start to finish of the clinical day that would just see the walk-ins. So, you know, there's different personalities in medicine. And even with pediatricians, some like to see the sick kids, some like to do the well child visits, some like to work with the behavior problem kids. And so we had a couple ladies that wanted to do more walk-ins. So they started seeing all the walk-ins. And that has worked well for us. We recently extended our hours. So now we see walk-ins from 7 a.m. to about almost 7 p.m. For behavioral health, I mentioned that. For occupational therapy and physical therapy, they do schedule appointments also, but it's kind of funny the way they do their schedule to me because they'll schedule like a 45-minute visit and they'll be with the patient for 30 minutes and they'll have 15 minutes to document. So I'm thinking, how can we get that going for us? But that gives them some time in their documentation time to go see consults, and they also have a lot of no-shows. So they usually have plenty of time, the therapy team does.
Then how does that work with the multiple locations that Jordan Valley has now?
Right, so pediatrics, we have probably the most integration with the different branches and different service lines. With other locations, like we have a clinic in Republic. In Republic, we have a pediatrician, we have a couple family practice PAs, and we have a dentist. So the dentist out there, I think she runs at least 4 columns also. We have a behavioral health provider out there. So if they need other services, they would have to be sent over to us or referred over or scheduled. But we're able to integrate the behavioral health and the dental pretty readily, pretty handily.
Optometry's out there too.
Yes, and optometry is out there. You're right. Dr. Reese is out there. And then at the downtown location, so we try to have medical, dental, behavioral, and optometry at every location. I believe we have all 4 in Hollister, Marshfield, and Lebanon. And Lebanon also has occupational therapy because they work really closely with the schools in Lebanon to do some work there. We have a partnership with school in Republic, Hollister, and Lebanon. So part of the community health centers, we do a lot of school partnerships. Yes, Ivan.
Do your providers have, can they work at Cox? Like, do they admit patients to the hospitals and see them there, or how's your relationship with the hospitals?
Yeah. So most hospital systems these days have hospitalist teams that do their admits. Both Cox and Mercy have hospitalist groups that do that. So when Jordan Valley started, they admitted their own adult patients to the hospital and took care of them there, rounded on them, did all the tests, all the care, all the orders. But over the years, that has kind of become a less popular model. So the hospitalist services take care of all our admits. At Cox or Mercy, they have pediatric hospitalists that take care of our kids when we admit them. We do go and see newborns on rounds, which is a lot of fun. So any patients that are going to follow up with us at Jordan Valley, or patients who are unattached, since we round on babies, they give us a lot of unattached patients. And sometimes they'll follow up with us, sometimes they'll follow up in Ava or Aurora or some other place if they're from a little ways out. But we pick up a lot of new babies that way also. So we don't do hospital admits currently. With women's health, it's a little bit tricky because OBs like to deliver babies, and they should, and it's fun. It's exciting. It's part of their, what they were trained to do. It's part of what they want to do. So, some of our women's health providers deliver babies. Some of our older ones who wanted to slow down a little bit and not be on call so much don't deliver babies. So it kind of varies. I'm sorry, you had a question.
Yeah, what's the next step in growth for your integrative model? Like, is there a next service that you guys are looking at implementing, or like, is there a certain area that you'd like to expand?
That's a great question. We did have speech therapy for a while, especially on the pediatric side. It was pretty important to us. We're still recruiting a speech therapist right now. So that's one thing we're gonna add back in. Another thing I didn't mention is we also integrate with, we call it lots of things now. SUD, I don't forget, substance use disorder, SUD treatment, medication assistance treatment, MAT-SUD, whatever you wanna call it. We also integrate that. I say we integrate it. We take walk-ins, and several of our providers will take on new patients and do the medication assistance treatment. That's a pretty big thing right now in our culture. Just with all of the fentanyl use, the opioid use. We were talking about that some, I think this week. When I was in school and in training residency, pain was the 6th vital sign. Or 5th, I forget how many there are. But it was the next vital sign. So they said if you do not ask a patient if they have pain when they come in and rate it on a scale of 1 to 10 and record it in the chart, you are not doing quality medical care. And if they have pain and you do not address it and treat them for their pain, you're a bad doctor. So that's kind of the message that we got when I was coming through training. So that's partly through the education process, I think, partly what happened with the increased use of opioids and chronic opioid treatment. Because we wanted to take care of people's pain, and if they say they have pain, who are we to say you don't have pain? So that was kind of the mentality back then. That's really dramatically changed over the years, especially as opioid use disorder has become so prominent. Fentanyl has become such an epidemic in our society, drug overdoses, all of that. So I don't know what the next service line would be. I feel like we have most of them. Is there anything you think of that we're missing? It'd be great feedback for my CEO. We have an express care downtown where they see a lot of, I cover it sometimes, and so we see a lot of STDs. We see a lot of just acute illnesses. We have a lot of people come in that just need to get refills on their medicines. They don't have a doctor anymore. So they'll come in with their blood pressure and their thyroid issues. They've been out of medicine for a month and are like, hey, I really need to get my medicine. So what we can do in that case is give them a month of medicine, get them an appointment with one of our primary care providers, and help them get on insurance, get on Medicaid if we can. So, yes.
I've answered your question and a question of my own. What I've seen in other practices that have been really helpful in the integrated model is nutrition.
Yeah.
So having like dietitians, that sort of thing. And my question is about your grant funding for the integrative model that you're using. Is it primarily through the state of Missouri, or is this through the feds? And then do you anticipate any potential issues or hiccups in funding based on anything that y'all are currently doing in your practice?
Right. So based on the DOGE stuff that's going on, we do expect to see some hiccups in our funding. Most of our funding is federal. Most of the state support comes through Medicaid. So what I didn't talk about with FQHCs is, excuse me, when you're in private practice and you contract with different insurance providers. Now, Pete can probably speak a lot to this. He probably has a lot more experience in this than I do. But when I was in private practice, my mentors in practice encouraged me. They said, hey, make sure you don't take more than about 10% Medicaid, or it's going to start cutting into your bottom line, meaning the money I take home. So Cox and Mercy both contract with insurance companies. They arrange, they prearrange, well, we're gonna, whatever we bill our 99214 code at, we're gonna bill that at $250, but the insurance says, well, that's fine if you bill us for $250, but we're only gonna pay you $175. So for Medicaid, when you're in private practice, you might bill them $250 and they say, well, we'll pay you $45. So it's really hard to even pay your expenses if you see a lot of Medicaid when you're in private practice. However, when you're an FQHC and you bill Medicaid $250, they pay you $250. So it's even better reimbursement than insurance in private practice. So the care is usually more involved. You have to have more support staff to get them to the office, to get them signed up for Medicaid. We do see a lot of cash pay patients at Jordan Valley as well. And we do, because we're an FQHC, we can provide a sliding scale or discounted costs. Whereas other entities that contract with Medicare cannot charge people less based on their ability to pay. Yeah, another question.
What does your case management look like at Jordan Valley?
Case management. So like we have nurse care managers who work with patients. They're also probably funded by grant money for the most part because they can't, but they do some things that get reimbursed. But most of the services they provide are non-reimbursable services. They call patients and check on them. They call them, say, hey, you have asthma. We haven't seen you in 4 months. You need to get in for your asthma recheck. So they do a lot of those things for us with our case management. We do have, most of our social workers, I'd say, are more involved with our behavioral health side, with doing some counseling, some brief therapy, seeing people when they're in crisis and getting them plugged into therapy. You mentioned earlier nutrition. We do have a couple dietitians on staff. We also have clinical pharmacists on staff. Our clinical pharmacists do a lot of work taking care of hepatitis C treatment, HIV treatment, because that gets really complicated if you're not doing that all the time. It's really easy to fall out of the loop. We have a clinical pharmacist who works with our diabetes patients. So when we refer people for diabetic education, you can do that wherever you are, whether it be, a hospital, a clinical setting, but somebody has to pay for that. Somebody has to take care of it. So at Jordan Valley, we have people inside. We have a clinical pharmacist, we have a dietitian or nutritionist, and they do our diabetic education. So they will have groups come in, they work individually with patients. They'll have patients come in between their office visits with me, for instance, and they might even, the clinical pharmacist might change their medicine or start them on something new. And they'll just send me a note and say, hey, I recommend we start this patient on Jardiance. If you're okay with that, let me know and we'll get it sent in under you. So then I just usually say, absolutely, sounds great. Go for it. So we do have a lot of collaborative care besides the different service lines as well. Yes. Ms.
Question
Tricia.
from Zoom.
Okay.
Did you mention audiology?
Did I mention audiology?
Yeah.
I did not mention audiology. So that is something we could add. We are working on adding ear, nose, and throats at the pediatric clinic because we do refer a lot of kids for tonsils and adenoids. We refer a lot of kids for myringotomy tubes or ear tubes. So we haven't talked about audiology. Speech therapy does work pretty closely with audiology at times, but that's something to think about. That's a good idea. Thank you, Zoom watchers out there, wherever you are. Hey, any other questions you guys can think of? So that's kind of, Jordan Valley, we get, and everybody thinks about federally qualified health centers, the government pays your bills or whatnot. Well, we get grants from the federal government for building projects. We get grants for certain other projects. It's like our community health workers, and basically our community health workers are just regular people with very little, if any, medical training but they just go in and talk to patients and say, hey, you know, what kind of needs do you have? Do you have a safe place to live? Do you have enough food? Do you have diapers for your child? And they ask those kinds of questions, and they help get them plugged into community resources to get the help that they need. That's one of the things I know is paid for by grant money. The nurse care managers, I believe, is paid for with some federal grant money, partially. Like I said, they do bill some reimbursable services, but most of the things they do are not really reimbursable, but they're very helpful. With our needy patients, they go in and spend time with them. They'll have them come in at other times besides their medical appointments. They'll help arrange for rides for them. They do all kinds of stuff. We've even had some community health workers like go and pick patients up and bring them in, which is, you know, fantastic above and beyond the call of duty. But most of the day-to-day cost of running a clinic are covered by our collections, just like any other hospital or clinical system. So we bill patients, or we bill Medicaid or Medicare, or when they come in, you know, we might provide services for them at a discounted cost. Like I was saying, we have a slide program. I think we have 4 levels on our slide now. So depending on what your income is, if you don't qualify for Medicaid, if you don't make, you know, a certain amount, you can get a discount on the cost of your care. That applies to labs, it applies to procedures. Those of you who've been with me, you know, I do vasectomies. So if you come in and pay for your vasectomy, if you pay in advance, you only pay, I think it's about $950, which is probably a lot less than you pay a urologist. If you are on slide, you might get it for $850 or $750 or even down to $650. So it's a pretty good deal. Circumcision's kind of the same way. Medicaid used to not cover circumcision. So when I first started at Jordan Valley, Medicaid would not pay for a circumcision. So a lot of people were driving to Joplin because there was a guy in Joplin who would do a circumcision for $150. Then the gas prices went up and we were doing them for $200. And so a lot of people started coming to us, more people started coming to us because they're like, well, I might as well just pay $200 and because I pay more than $50 in gas to get the Joplin back. And then we were running a special where if you did your pregnancy care at Jordan Valley, we'd circumcise your kid if you had a boy for $50.
Oh,
Let's steal it down, yeah.
like a BOGO.
Yeah. Buy one, get one half off. We take the whole thing off. Sorry,
gonna make
part of
that
the
joke.
ones. I am a dad, I know.
Terrible.
Yeah.
So speaking of OB, so
Yes.
whenever I was pregnant with my first child, I was in college and I was a poor college kid. And Jordan Valley did my prenatal care. Actually, Dr. Stinson did my prenatal
Yeah.
care.
Fantastic.
And so he, you know, did not deliver, obviously. So I was just kind of told, just go in and
Right.
you'll have whoever's on hospital is, you know, on call duty for.
Did you deliver at Mercy or did you go to Cox?
She was Mercy.
Okay.
So is that kind of still how they do it, or?
Yes, we have a couple arrangements. We have an arrangement with the Cox Family Medicine Residency. So they were doing a lot of deliveries for us. And we let our patients pick if they want to deliver at Mercy or Cox because they can go either place. They deliver at Mercy. I believe a couple of our OB providers deliver at Mercy, or they were, not sure if they still are or not. And so if they deliver at Mercy, they might get their own OB or they might get one of the hospitalists or one of the other people that cover. If they went to Cox, they were supposed to be delivered by the residents, and that helped boost the residency's OB delivery numbers. I know that that's kind of changing right now, so I'm not sure how that's all gonna pan out. Yeah. But it'll be good. So yeah, it said I was supposed to present some cases too, is that right?
Oh, no, that's not today,
Okay. good.
unless you want to.
I think it's a case presentations. I'll have some cases for the next time. I was telling, I mean, we see some really crazy stuff at the Valley, as I like to call it. You never know, it's always an adventure in the Valley, as I say. Yeah, I think we see probably a higher percentage of the child abuse that takes place in Springfield than most clinics, but it can happen anywhere. I've seen my fair share of that. over the years. We see a lot of foster kid physicals. Any of you foster kids? No? Anybody adopted? No? So, my wife was adopted. Her dad does not know that she exists. Really interesting. Her and her brother. But I see a lot of foster kids. One day, it was like 4:30 in the afternoon. I was, tired. I've been in clinic all day, and we don't turn away any sick kids. We also don't turn away 24-hour foster physicals. At least that's what my bosses tell me. So that's what I try to do. So we had this foster family come in. They just got 3 foster kids. 4:30 in the afternoon. I'm like ready to go home. I'm wore out. And they're like, hey, Dr. Strong, we got this foster family come in. We need a couple foster care physicals. I'm like, okay, well, what do you need? They're like, well, she's got 3 kids, blah, blah. I'm like, 3? It's like, are you serious? I was like, can't we split them up? Have a couple of us, see a couple different providers, see 1 kid each. They're like, well, she wants to keep them all together. They've been through a lot. And I was pretty irritated. So I was like, fine, I'll see him. So I went into the room already irritated. And I walk in there and it's this real sweet lady. She's got 3 kids with her. I think they're all like 9 to 12, like 9, 10, and 12. And I come to find out their mom had just died. That's how they came into foster care. And the little boy overheard the lady tell me that. He said, yeah, then our dad died the next day. So I'm just like, oh man, that's really terrible. So the mom the foster mom said, yeah, he shot himself after his wife died. Or, the mother of the children. And so the kids didn't really know that he committed suicide, but that's what happened. So it's just this horrible situation. And, here I am wanting to go home and not take care of people. So I felt really awful. And seriously,
Yeah.
And anyway, so I went and got my behavioral health person. We got him taken care of. We got him plugged into some therapy and some counseling because, those kids have been through a ton in the past week. And this lovely couple who already had a couple of their own kids and went to church with them was going to take on these 3 new kids and just take them on because, man, their parents were gone. There's nobody left. But that's the kind of stuff that we get to be a part of a lot of times at Jordan Valley. And it really makes, going home tired at the end of the day, but you feel like you made a difference and it's rewarding. So, there you go. I think that's all I got. I can tell you more terrible stories. Yeah, and as students, you play a really big role because a lot of times you get to spend a little more time with the patients. And I've had several patients, especially my teenage girls who may not want to talk to some old guy. But when I have a younger student come in the room, they connect with them a little bit differently. And they will tell them things that they maybe wouldn't have told me. And sometimes it's really significant. Like, my stepdad's been having sex with me for 10 years. Or, something else terrible. But we're able to step in and hopefully make a difference for these kids.
I did ask if there was any questions on Zoom.
All right.
Nobody said anything, but
Thanks-
if there are any
thanks,
questions on
Zoomers.
Zoom.
Okay.
pop in.
Thanks, everybody. Good to see you. Best of luck as you continue your studies. Work hard. Be on time. If your attending says, hey, I'm doing this later. If you'd like to join me, you can, but you don't have to. Always say, oh yeah, I'd love to come. I'm just kidding. All right. That's all.